you're on camera again.
Okay.
So the question, we talked a bit about the MDVIP situation where certain physicians, when they'd contacted their patients, then contacted their insurance providers, and the providers then contacted the physicians to say, you're out of network. How would we work around that? What would you be telling the payers about this $10 a month technology access fee?
Right. So as a technology access fee, it's perfectly reasonable because even with other firms, if you look at your eClinicals of the world or Allscripts, etc., they all offer what are called patient portals.
Right.
You can simply just call this patient portal. It's an access fee to the patient portal. So that's very easy to say.
Right.
The other thing to think about is that if they say, well, no, this is going to somehow hamper our ability to do work with us, with our physicians, you are actually helping them improve that relationship between the physician and the payer. And then the third piece is you can simply, physicians, if they're getting alternate money from some other sources, like with Micah's assistance, they're not likely to go after rejected claims as heavily as they would otherwise. So we know that payers are going to reject claims. That's going to happen. And if we say that this alternate revenue stream will keep physicians off your back, will keep patients off your back by not having to go after rejected claims as much as they would just to maintain a certain level of income, the payers will be okay with that as well. So there's actually several ways. With MDVIP, the reason why the payers didn't like them is because they were replacing the insurance firm. Right, and of course, in this case, you're not saying you're going to replace them. You're trying to improve the relationship in multiple ways. One is with better technology. Two, allowing the patient to have a better relationship, and that way the cost. It's not like the patients, after paying $10 a month, are going to assume that their insurance fees have to come down. They're not going to assume that at all. In fact, that's not something that they'll even talk about. What they will like, though, is where if they can get access to the patient. The way to perceive this is that you sell this into a payer by saying you need more physicians who are doing who are working with Micah than others, because number one, they keep patients off of your portal directly from a money perspective, and they keep them in the physician. There's a better relationship there. Because the physicians have an alternate revenue stream, they're not likely to go after and chasing the rejected claims as much as if they would otherwise. So it leaves a little bit more money on the table on both sides, yet both sides are actually happier because they're both getting additional funds.